Come in.
Hello, my name's Lauren. I'm your nurse for today. I'm just going to wash my hands and we can get started.
Great.
Okay. Now I'm going to check your name and date of birth against your hospital band, okay?
Okay.
What's your name and date of birth?
Alex Morales, November 25th, 1984.
Okay. And, alright, Mr. Morales, what brought you in today?
I have some abdominal pain on my right side.
On your right side? Okay, and is it, how would you describe the pain?
Like a sharp pain.
Okay, and is it constant or is it?
It's constant.
It's constant? Okay. It doesn't come and go?
No.
Okay. Is there anything that's making it better?
Not really, no.
Not really? Okay. Alright, well, today, since you just were admitted, I have to do a full assessment on you, okay? And it's going to be a little bit uncomfortable because of the pain. Just let me know if anything hurts, you know, and we can...
Okay, that's
okay?
fine, thanks.
Alright, so we're going to start with your head and work all the way down to your feet, okay?
Alright, sounds good.
Okay. So I'm just going to palpate your scalp. Make sure your head's nice and round and even. Correct size. Everything feels good. Okay. Alright. Now, can you open and close your mouth for me while I... Alright, perfect. Any stiffness or pain when I do that? Okay. I'm just gonna, that's your temporomandibular joint. And I'm going to palpate your temporal arteries too. Okay. Alright. And then I'm going to just check some cranial nerves by having you open your mouth and clench your teeth for me. Okay. Now close your mouth and puff out your cheeks. Okay. All this is going to feel strange, I know. Alright, unpuff your cheeks. Now squeeze your eyes very tight. Okay, let go. And wrinkle up your forehead for me. Perfect. Okay. So we're going to check your vision now. I'm going to just follow my finger with your hands without moving your head, okay? To the side, corner. Great. Okay, that's perfect. Alright, and now we're going to do another test of your peripheral vision, okay? I'm going to give you this card. Cover your left eye with it, and I'm going to cover my right eye, okay? And you tell me, I'm going to go down to your level, you tell me when you can see my finger come into your line of vision.
No.
Okay, now do it with the opposite.
No.
Okay, great. Your peripheral vision's better than mine. Okay. Now I'm just going to check your pupillary response to light.
Okay.
Okay, so let me see your pupil size now. Then I'm going to dim the lights, okay? Great, they accommodated well. And I'm going to do a similar thing with my pen light, okay? So I'm going to have it dark. And then, whoop. Great. Dark. Okay, perfect. I'm sorry about that. I know that can be uncomfortable. Okay, now let me check your ears. Okay. I'm going to look in with my light. Great. Pull up a little bit so I can look in a little better. Okay, and I'm just going to feel around, okay? Any pain?
No.
Sensitivity?
No.
Any discharge you've been having from your ears?
No.
Okay, and I notice them, they're not red or swollen or anything. That's good. Is your hearing well?
Yes.
Okay. Great. Okay. So your ears look good. I'm going to check out your nose. Just make sure that it's nice and even. Okay. And I'm going to hold this. Breathe in. In. Great. And then this side. Perfect. You feel like you're getting good air with both sides?
Yes.
Okay, great. Okay, now we're going to do your mouth. I'm going to inspect your lips. Not dry at all. Okay, let me see your gums. Open up so I can see your gums. Okay, can you roll your bottom? Okay, perfect. Okay. Now let me see inside. Open up. Let me look at the arch the roof of your mouth. Good. Say ah. Okay, now I'm going to put a tongue depressor in there. And look at your pharynx. Great. Okay. That's perfect. Okay. And then just stick your tongue out for me all the way. Okay, great. And then put it back to your mouth and let me see the open up. Great. Right under there. Everything looks good. Now I want you to push out each cheek with your tongue. Perfect. Okay. All right. Now I'm going to palpate your thyroid. Okay? And your thyroid's right here in your neck. Okay? Just going to squeeze you forward a little bit because I can't get by a lot of places now. Okay. So, I'm going to have to displace it over to this side. And I'm going to check it like this. Okay? And can you swallow for me? Okay. Great. And I'm going to do the same thing on the other side. Okay, and swallow. Okay, feels good. No nodules or anything. Okay. Okay. Now I'm gonna check your lymph nodes. All right. Lymph nodes in your neck. Okay. Just do it lightly. A little farther back than that one. Okay, I'm going to check here, Alright, no inflammation or anything. Okay, feels good. Alright, now we're going to feel your carotid artery here, okay? And if you start to feel dizzy or anything, just let me know, okay? Okay. Okay, and I'm going to listen to it with my stethoscope. I'm going to clean off my stethoscope first, though, for you, okay? It's an alcohol wipe. Okay. And you don't have to do anything special. Okay, great. Okay, Mr. Morales. I'm going to listen to your heart, okay?
Okay.
I'm going to be listening to your different valves open and close, and I'm also going to be listening for what we call your S1 and S2 sounds. When you listen to your heart, I don't know if you've ever heard of how heart sounds. It goes lub dub, lub dub. The S1 is the lub, and the S2 is the dub. So we listen for them using the big part of my stethoscope, the diaphragm. And we listen for S1 at the apex and S2 at the base. And your heart is, when we map it out, it's actually inverted. So the top of your heart, the apex is going to be at the bottom. The base is actually at the top of your heart, okay? So I'll be listening for that now.
All right.
So first we're going to listen to your... And this is your pulmonary artery. Your mitral valve. Your pulmonary valve, your mitral valve. This is called Erb's Point. Your tricuspid. And your mitral valve. Okay. Then S1. And S2. Perfect. And I'm just going to listen to it with the other side just so that I can make sure I don't hear any additional noises. Okay, perfect. Okay, Mr. Morales. Now, we're also going to be listening to, I'm going to be checking your peripheral arteries, okay? We're going to start with your wrists. These are your radial arteries. Great. Then I'm going to go behind your knees for your tibial arteries. And I'm going to feel your dorsal pedis on your feet. Okay? On the tops of your feet. Great. Okay. Now, we're going to check out your chest and your lungs, okay? So I just need you to turn around for me. And we're going to start with percussion. What percussion means is I'm going to use one hand to hit my other hand, and I'm going to see how it feels, okay?
All right.
Okay. So it helps tell me where the air is. Where you have the organs, okay? And we'll also do that on the front.
Okay.
Okay? And now I'm gonna listen for your tectus fermentus. Okay, so I need you to say 99 for me over and over again.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Okay. And I'm going to percuss your cluster ventricular angle just to see if you have any tenderness, okay? Let me know if you have any pain.
Okay.
Any pain?
No. No.
Okay, perfect. Okay, now I'm going to listen to your lung sounds in the front, in the back, and on the sides. But we'll start with the back since you're already back here, okay?
Okay.
Okay. Nice deep breath with your mouth open, okay? This whole time, I want you to breathe with your mouth open.
Okay.
Let's go. In and out. 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 Great. Now move you so that I can listen to the front, okay?
All right.
In and out. 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 Okay, let me know if you ever get lightheaded with all this deep breathing, okay? Now I'm going to listen from this side, okay?
Okay.
Give me a deep breath in and out. 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 And in and out. Okay, perfect. Okay, now for the next part of the exam, I need you to be laying down for me, okay?
Sure.
So if you just lay down with your head this way.
Okay.
Okay. Now, what we're going to do is an abdominal assessment, okay? So I'm going to start by inspecting your abdomen. I'm going to lift up your shirt, okay, just so I expose just your abdomen where I need to see. Okay. Now, everything's equal. You have normal hair distribution, normal skin color, no scarring of any kind. Perfect. Okay. So, first I'm going to listen, okay?
All right.
Have you been having normal bowel movements?
Yes.
Okay. How many a day?
4.
4? Okay. That's a lot.
3.
No, if it's 4, that's okay.
Okay. 4.
Okay, everybody's different. Okay, and what I'm doing is I'm listening for your bowel sounds. It can take up to 5 minutes in each of the 4 quadrants, so this might take a little while, okay? But just relax and Okay. All normal. I'm going to listen for the arteries of your abdomen also now while I'm listening. This is your aorta. Your left renal. And your right renal. Your right iliac. And your left iliac. And I'm going to have to go a little bit low here. This is your femoral. And your right femoral. Okay. Perfect. Okay. Now, I'm going to have to palpate your stomach, okay?
Okay.
That might be a little bit uncomfortable because of the pain. Just let me know when you're having pain and I'll... That way I can document it and let the physician know. Okay. Any pain?
A little bit, yes.
There? Okay. Just, you know when I'm pressing lightly?
Slightly.
Okay. Here?
Yes.
There too? Okay. How about over here?
No.
Okay. 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 Now, I'm gonna percuss your abdomen, okay? Just like we did on your back. And I should have done this before I did the palpation, okay? Okay, and I'm just gonna map out your liver. Okay. I'm going to do some deeper palpations, okay? Pain?
Yes.
Yes. Okay. The whole time?
Yes.
Up here also?
No.
Okay. Now when I press down over here,
Mm-hmm.
do you have pain?
No.
Now?
Yes.
Yes, that hurt?
Yes.
When I lifted my hands up?
Yes.
Okay. Alright. That's good to know. Okay. I'm going to just feel for your liver, your spleen, and then your kidneys, okay?
Okay.
Okay, this is your liver here. Okay, perfect. Very similar with your spleen. Okay, I don't feel any splenic enlargement or anything. That's a good thing. Okay, and then your kidneys. I'm going to have to press a little bit hard for your kidneys, okay?
Okay.
So let me know if it's too much for you. You seem to be taking the pain pretty well. Okay. I'm going to repeat the same thing on the other side. Okay. And then I'm going to feel for your aorta. Okay. No enlargement or anything there. Okay, perfect. Alright. Okay. Now we're going to do some neurological checks, okay?
Alright.
Okay. And what I'm going to do is, can you sit up for me?
Sure.
And we're going to go back to the chair. And can you just push the chair back just a little bit? Okay. So we're going to start. I'm going to put my hand here, and I need you to rotate your face against my hand. Okay. And on this side, same thing. Great. Put my hands on your shoulders against some resistance. Shrug up. Good. Look, you knew what to do before I even asked you to do it. Great. All right. So, can you also, with your upper extremities, with your arms, I'm going to need you to, like if you're playing patty cake with your knees, down, and then the bottom down, yeah. So, just like that. Can you do it a little faster? Okay, you don't have to do it that fast. Yeah, make sure you get a full, good, perfect. Okay, we're going to do another test now. Okay, with your fingers, I need you to touch your, with both hands, your thumb to each finger, and then go back the same way you came. Great. Okay, that's perfect. Okay, now I want you to, with your lower, I need you to get back in the bed.
Sure.
And you can lay the other direction now.
All right.
Okay. And with your, can you touch your knee to your heel? And then run that heel down to your foot. Great. And do the same thing with the other leg. Okay. And then we're going to do a, let me check your toes while you're laying down, okay?
All right.
Okay, that makes more sense. Okay, so your big toes look normal. Can you spread them out for me? I'm going to have your socks off now, okay? All right, and both sides fan out equally. Okay, now what I'm going to do is I'm going to use a tuning fork to touch your bony prominence on your foot.
Okay.
I'm going to hit the tuning fork with my hand, and then put it there and let me know if you feel vibrations.
Okay.
You feel the vibrations?
Yes.
Okay, and do you feel the vibrations?
Yes.
Perfect. Okay, great. Now if you could sit up for me again. Oh, wait, let me do your Achilles reflex while you're laying down. I'm sorry.
Sure. Oh, it's okay.
Okay. Now, put your knee, put this foot on top of this leg, and just let your knee fall open. Okay? Okay, you had a little jerk there of your foot. That's perfect. Want to hit your Achilles tendon. Okay, great. Okay. Now, if you could sit up for me. Okay. I'm going to do a patellar reflex, or the knee jerk reflex, okay? So I'm going to hit right here with my, great. Okay, perfect. Now we'll do your tricep. Great, and the other arm. Good. Very good. Okay, now I need you to stand up for me, okay? Okay. I'm going to do if you could just go over there for me. This is called the Romberg test, okay? And it's going to check your balance.
All right.
Okay. Can you just close your eyes and stand still for 20 seconds, okay? Perfect. No swaying or anything. That's great. And then can you walk for me? Just to show me your gait. All right, great. Turn around and walk back to where you started, but heel to toe for me, okay?
All right, no problem.
Great. Okay, you can go ahead and have a seat, Mr. Morales. That's everything we had to do. I'm going to wash my hands, and then I'm going to document our findings and let the doctor know, okay?
All right, thank you, nurse.
Okay, washing my hands. All right, do you have any questions about our exam?
No, everything was thorough.
Okay, thank you so much, sir.